Hello, everyone, and welcome to our webinar titled Understanding the Undocumented Immigrant Experience, Healthcare Challenges, and Genetic Counseling Strategies. This webinar is brought to you by the UndocuGC Network with funding from the Florida Association of Genetic Counselors. My name is Daniela Diaz-Caro, and I'm a research genetic counselor at Columbia University Medical Center. And I'm joined today by my colleagues, Estefania Alastre, a bilingual genetic counselor working in cancer at Motif Medical Center, Daisy Hernandez, a bilingual cancer genetic counselor at Los Angeles Medical Center, Stefania Soto Mangandi, who is a second-year genetic counseling student at the University of Maryland, Alicia Lewis, who is a health administration student and clinical research coordinator at Columbia University Medical Center, and Jean Miriam Yassis, a first-year genetic counseling student at the University of California, San Francisco. As a collective group, none of us have any conflicts of interest to disclose. And as organizers of this webinar, we wanted to take a moment to recognize our positionality as presenters and the pivotal role that our diverse lived experiences have in informing our commitment to today's dialogue. So our group is made up of individuals with DACA status, those who have been undocumented in the past, who have family members who are undocumented, or are professionals working in genetic counseling who work predominantly with patients who are undocumented. Our lived experiences shape our dedication to advocating for equitable access and our goal of empowering genetic counselors to provide compassionate care to all patients, regardless of their immigration status. Along with that, we would like to emphasize that the information shared in today's presentation may not fully represent the full breadth of the undocumented patient experience. This presentation was created in October of 2023 and provides accurate information as of the current date. For the latest updates, requirements, or legal considerations, we suggest consulting the organizations referenced within this presentation. So you might be wondering, why is this topic important for genetic counselors? Well, as genetic counselors, we play a role in our healthcare system, and as such, we have a responsibility to ensure the fair and just delivery of care. And in order to provide truly equitable care, it's helpful to understand the experiences of our patients, and that includes the experiences of those who are undocumented. This understanding is essential to provide compassionate support and psychosocial counseling that is tailored to this population's unique experiences and specific needs. Now that we've established the significance of this topic for genetic counselors, let's delve into the specific learning objectives of this presentation. First, we will define aspects of the undocumented immigrant experience. And by that, I mean that we will focus on describing demographic information of this population. We will define some terminology and legal terms and highlight the experience of immigrating and living as undocumented in the United States. Then we will examine the specific challenges that undocumented immigrants face when seeking healthcare and how this immigration status may play a role in a genetic counseling visit. And lastly, we'll go over strategies and resources that can be specifically helpful when providing genetic counseling care to undocumented patients.
So let's begin with the first learning objective, defining aspects of the undocumented immigrant experience. Starting with words matter. So when discussing someone's immigration status, it is advisable to use language that is respectful and inclusive. Similar to the principles of people first language, the emphasis should be on acknowledging the person before their immigration status. So, for example, it's better to say individual without immigration authorization or person of undocumented status. However, it's crucial to remember that the preferences of the individuals or families that are impacted by immigration status may vary. Some may identify as undocumented and take pride in their resilience and determination, and choose to use that language. Therefore, while people first language serves as a respectful starting point, it's important to adapt your language based on the choices and preferences of the individuals and families that you are addressing. Prioritizing their preferred terminology ensures that you show respect, and furthermore, terms such as illegal immigrant, or illegal alien to describe individuals suggest that their entire existence is inherently unlawful, which ultimately dehumanizes these individuals. It really fails to recognize their humanity, their individuality, their experiences, and their overall contributions to society. So people should not be defined solely by their immigration status. As a collective group and based on our own experiences, we decided to use the language we felt was most representative. And for that reason, throughout this presentation, you will see us use and hear us use the term undocumented immigrants. Now, defining who undocumented immigrants are is also important for us. So by definition, undocumented immigrants are individuals who reside in the United States without federal documentation that provides either authorized entry, residency, or work authorization. So these individuals may have entered the United States without proper authorization or violated the terms of lawful admission and residency. So, for example, an undocumented immigrant may be an individual who obtained a work visa and resided in the United States after their visa expired. Additionally, we'll talk very briefly on a subset of undocumented immigrants, and these are undocumented immigrants with temporary relief. So some undocumented immigrants, based on specific criteria, have obtained temporary relief status through policies and programs such as the Deferred Action for Childhood Arrivals, which is typically referred to as DACA, as well as temporary protected status, which is typically referred to as TPS. Starting with DACA, DACA is an immigration policy in the United States that allows some undocumented individuals who were brought as children to obtain a renewable 2-year work permit and overall deferment from deportation. Now, as of October 2023, new applications for DACA are not being considered. However, renewals are still being accepted. And while DACA has provided a number of undocumented immigrants with temporary protections, the fate of the program remains uncertain due to ongoing legal, political, and legislative developments. Additionally, TPS is a program that allows immigrants whose home countries have been deemed unsafe by the United States, either due to ongoing armed conflict, environmental disasters, and other extraordinary and temporary conditions, the right to temporarily live and work in the United States. Now, for the purposes of this presentation today, we will focus largely on undocumented immigrants with no temporary relief. Now, this next image highlights some of the difficulties undocumented immigrants face when attempting to obtain citizenship or lawful status. Obtaining citizenship status as an undocumented immigrant with temporary relief is possible, but incredibly difficult due to financial implications and just overall legalities. Immigration in the United States is generally limited to 3 different routes, including employment, family reunification, or humanitarian protection. all of which are highly regulated and based on very, very specific eligibility requirements. So as a result, it is nearly impossible for undocumented immigrants that do not hold temporary relief to obtain citizenship status because there are truly no means to achieve this lawful status to begin with. Now, it's also really important for us to understand the demographics of this population. So the United States is what we would consider to be a mosaic, a very rich medley of diverse cultures and ethnicities that have been pieced together to ultimately become one. And each of those pieces contributes a sense of uniqueness to a much larger work of art. And it really has been that way for generations. As different communities have immigrated, they have brought upon this country their culture, their values, and ultimately their socio-cultural contributions. Now, the undocumented population is one of many immigrant communities that have enriched our history. Unfortunately, this community has been unfairly casted in a negative spotlight, leading to the negative perception that the undocumented immigrant is inherently an unlawful being, which, as we discussed a little bit earlier, this portrayal or really a stereotype can have very dehumanizing effects, and ultimately it really is far from the truth for these individuals. With this slide, we really just want to highlight that the experiences of each undocumented immigrant is unique, as each person has an individual set of identities and factors that contribute to their experiences and their overall experiences in life. Demographics of undocumented immigrants residing in the United States by the Migration Policy Institute have highlighted their broad range of intersecting identities. They come from various regions, as you can see on the graph in the left, and they encompass different cultures, different languages, and different traditions. This community includes a wide range of ages, including young children to older adults, diverse parental and marital statuses. Some of these individuals are married to United States citizens. Some individuals marry other undocumented immigrants, and it can really vary from person to person. Education levels are also different within individuals of this population. And these individuals really do hold jobs across multiple industries, ultimately making vital economic contributions as well.
Undocumented individuals may have differing experiences due to a variety of factors throughout their journey. Because of this, we wanted to share some examples of why and how these communities may migrate, and also discuss the differences between pro-immigrant versus anti-immigrant laws. Many individuals may decide to migrate to the United States for a variety of reasons, some of which can generally be conceptualized as push and pull factors. Push factors are conditions in migrants' home countries that make it challenging or even impossible to live there. Meanwhile, pull factors are circumstances in the destination country that make it a more preferable and appealing place to live compared to their home countries. Some examples of push factors include violence, gender inequality, political corruption, environmental degradation, and climate change, as well as lack of access to adequate healthcare and education. Common pull factors include more economic and work opportunities, the possibility of being reunited with family members, and a better quality of life, including adequate access to healthcare and education. There are also many circumstances by which undocumented individuals have migrated into the United States. Many people don't realize that undocumented individuals may have entered the country lawfully through port of entry with inspection. Some may have entered with border crossing cards or overstayed their visas as tourists, students, or business visitors. On the other hand, individuals may have also entered the country without inspection by evading immigration inspectors and border patrol. Depending on the state that an undocumented individual chooses to reside, varied laws and policies may result in different repercussions for immigrants living in the United States. This is because state legislatures and governors across the country have a crucial choice on immigrant enforcement of detainment and/or deportation. This is separate from federal government infrastructure. So, for example, a state may decide to pass sanctuary policies to protect their residents, pass anti-immigrant policies that harm residents, or they may choose to remain neutral. An example of this is commonly seen through enacted legislation in states that offer driving privileges to unauthorized immigrants versus other states that do not. We'll be expanding upon the limitations and issues surrounding healthcare services and other contexts across federal versus state levels in our later sections. But now we're going to move on into the emotional and psychological impact of being undocumented. And immigrants may face a combination of chronic stressors throughout their life that can cause significant mental health impacts. Many may be constantly living in fear of deportation, which can lead to continuous feelings of anxiety and uncertainty about the future. Individuals may be separated from their relatives for long periods of time, and having limited support socially can result in feelings of isolation, loss of identity, and even harm to familial bonds and relationship dynamics. Additionally, undocumented immigrants also deal with acculturation stress. They may be faced with mental and emotional challenges of adjusting to dynamic environments, communication methods in a new language, and enduring the loss of their culture while learning to adapt to a new one. Throughout this adjustment, immigrants carry their past experiences with the process of immigration or detention. As previously mentioned, legal pathways for immigration are very limited and very challenging to achieve, and not all processes are the same or linear for every individual. The impact of hardships endured throughout resettlement and the reorientation process is long-lasting. There are also others who may have experienced detention, and this time in solitary confinement may contribute to other emotional traumas, such as risks of depression or even self-harm. Lastly, we wanted to discuss scapegoating, stigmatization, and discrimination of undocumented individuals from the public, and this may be a result due to misinformation and propaganda. This may induce feelings of shame and may negatively impact an individual's self-esteem and self-worth. As you can see, these factors are well connected, with each of these factors impacting one's emotional and psychological well-being. Now we'll move on to the next learning objective, which is focused on healthcare challenges that are experienced by undocumented immigrant patients. Before continuing with this section, it's really important to mention that immigration status is, by its own right, a social determinant of health. That means that the immigration status of an individual in the United States is a factor that's linked to the health of that individual, often in a detrimental way. Like gender or race, immigration status is another form of everyday inequality that may be pervasive and inescapable. There are different social determinants of health that any given population is exposed to at any given time. Immigration status has a significant impact across all categories, as demonstrated by this chart graphic. From the lack of opportunities ranging from educational attainment to labor protections in work settings, as well as lack of citizenship rights, undocumented immigrants are exposed to constant obstacles and barriers to their physical and psychosocial well-being. We will now move on to cover the barriers encountered specifically in clinical settings.
It's important to recognize that undocumented immigrants have limited access to healthcare coverage in the United States. Despite this, the Emergency Medical Treatment and Labor Act, also known as EMTALA, is a federal law that prevents emergency departments from turning away patients seeking emergency care, regardless of their insurance or ability to pay, and their immigration status. While a few states have taken initiatives to implement policies and programs aimed at expanding access to care, many have failed to recognize the importance of addressing the healthcare needs of undocumented immigrants, or they've been restricted in doing so. A number of states have programs and services focused on meeting the needs of vulnerable populations, such as pregnant people and children who are low income, regardless of their immigration status, which I've highlighted here on the right. Very few states include access to coverage for adults and seniors. At the state level, as of 2023, 5 states, including California, New York, Illinois, Oregon, and Colorado, as well as Washington, D.C., have taken steps to expand healthcare services to undocumented adults. California's Medi-Cal program provides emergency services to those seeking care. In addition to this, in 2020, it expanded its state coverage to include individuals ages 19 to 26, as well as those 50 and over, regardless of their immigration status. California expands or plans to expand coverage to more groups in 2024. However, despite this expansion, the scope of care available to residents, including undocumented individuals, remains restricted. New York also offers emergency Medicaid to those seeking emergency services. In addition to this, its NYC Care initiative provides healthcare services such as primary care and certain specialty services to income-eligible adults and seniors, regardless of their immigration status, at NYC Health and Hospitals clinics. The policies and programs implemented in New York, California, and the states previously mentioned primarily focused on the healthcare needs of low-income individuals, which is very important. However, this care may not be as comprehensive and have the same quality as that of individuals with greater access to coverage. The impact of limited access to coverage is profound and affects both patients and their providers. For example, when looking at the patient impact, patients must reach a critical point or require emergency services before they're able to access medical care. The implications of this are particularly evident in undocumented patients requiring dialysis. For example, most patients with kidney failure or end-stage renal disease require routine dialysis treatment. However, since undocumented immigrants have limited access to coverage, they may not be able to access the necessary treatment unless they're in a state of emergency. This has the potential to exacerbate their condition, cause them unnecessary psychosocial stress, and ultimately lead to worse patient outcomes. Additionally, it should be noted that depending on the state they're in, undocumented immigrants aren't eligible to receive organ transplants. Aside from this, due to the constraints of their coverage policy, certain groups of patients may only have the ability to obtain healthcare coverage for a limited period of time. For example, in the prenatal setting, we see that coverage for undocumented patients may only be available for the duration of their pregnancy or for any pregnancy-specific conditions. Therefore, patients may need to obtain all of the care they require in a shortened period of time. Care coordination is therefore very important, and it may require excessive planning in order to complete tests and screenings within a timely and efficient manner. As we know, genetic counselors play a vital role in such coordination. When examining the provider's point of view, providers may find themselves facilitating workarounds to meet the needs of their patients due to limited access to care. This might misalign with their professional norms and workflows and even lead to moral distress. Additionally, providers may experience burnout by consistently having to treat undocumented patients within an emergency care setting or in a limited fashion, rather than meeting their long-term care needs, because these patients are ineligible to receive coverage for comprehensive healthcare services. When seeking healthcare, patients who are undocumented face additional barriers beyond healthcare coverage, which are both the result of institutional and individual factors. Institutional barriers include resource constraints, such as lack of appropriate genetics interpretation services. Providers might also not have the capacity to accommodate for all of their patients' needs. Additionally, there may be limited transportation options in getting to clinical appointments. Also, hospitals' operating hours might not align with the hours when patients are working. Aside from this, hospitals may have limited funding opportunities or charitable funds to allocate to their undocumented patients. Additionally, widespread discriminatory practices, stereotypes, and lack of provider knowledge within the healthcare system has been cited as a barrier to accessing care for undocumented patients. Switching over to the individual level, undocumented patients may face barriers such as limited social capital in the form of language difference, which may cause them to not be able to effectively communicate their concerns with providers and other healthcare professionals. Additionally, they may fear the possibility of deportation in healthcare settings, which are oftentimes very highly regulated and have strict security measures. Lack of familiarity with the already complex healthcare system in the United States is also a barrier to care. Lastly, financial constraints and limited access to affordable coverage also restricts the type of care, if any, that undocumented patients are able to receive.
When seeing a patient in clinic you are aware is of undocumented status, it is important to consider if disclosing their immigration status in the medical record is necessary. The answer is not clear nationwide and depends on state legislation. For example, the relatively new bill in Florida, SB 1718, requires the hospital to request immigration status upon registration, but patients can decline to answer and still receive medical care. Not all patients are aware that they can decline, and the question alone can be a factor that deters a patient from seeking health care. Having state legislation require these questions upon registration does not indicate that we should document this on our note. There are other factors to consider regarding the long-term well-being of the patient, such as 1. What is the purpose or benefit of documenting this information? 2. Consider that should medical records be requested by governmental agencies or immigration enforcement officials, this information would expose the patient and could potentially be utilized for targeting of the individual. 3. The immigration status of the patient could change in the future, and previous documentation is difficult to edit and may follow the patient for a long time. And 4. The risks of documenting the status are constantly changing and outweigh the benefit of documenting. Overall, documenting the immigration status is not recommended by several organizations such as the American Medical Association and the National Immigration Law Center. Use verbal communication for sharing this information. The public charge concept was established by Congress in 1882 as a way for the U.S. government to deny a visa or authorization permit to any person who was unable to take care of themselves financially and might become a public charge or require financial assistance from the government. This policy discriminates based on disability and poverty. If someone is deemed as potentially needing to go on welfare, require Medicaid, or be institutionalized at government expense at any point in their life, they may be denied a visa or authorization permit. To determine how likely someone is required to need government funds, the government requests information from an immigrant applying for authorized entry, such as 1. Proof of their income to debt ratio, 2. Their education level, 3. Have they used public benefits such as cash services from federal or state government, and 4. Has the person been incarcerated or institutionalized at government expense? The public charge policies have evolved since 1882, with some administrations increasing or decreasing the criteria for which a person might be deemed ineligible to receive an authorization permit. So let's talk about how public charge is relevant to genetic counseling. When it comes to offering a patient free of cost testing via a laboratory, it is important to determine where those funds are coming from. For example, federal or private. It is reasonable that a patient may have questions as to the nature of these funds. There is no precedent immigration retaliation based on receiving free of cost genetic testing, but that does not mean it cannot happen. Consider where the patient is coming from if they decline testing, and suggest they see an immigration attorney for legal guidance if they request more information before deciding to accept or decline the free of cost opportunity. Something else that is applicable to not only undocumented patients and is important to keep in mind involves the facilitating of predictive testing for families in other countries via laboratories such as Color or Centogene. It is important to keep in mind that some of the legal protections available here, such as GINA, may not be available in another country. Additionally, those relatives may not be able to access the recommended screening based on the result. Proceed with caution when facilitating predictive testing of relatives in other countries, and always encourage they seek legal advice from an attorney or other expert in their home country. Lastly, there is one other consideration we felt was important for genetic counselors to be aware of, and that is that since 2018, DNA samples have been collected from immigrants, including children held at the U.S. southern border by the U.S. Customs and Border Protection Department. We don't know how this information is being used in its entirety and or what repercussions it might have for the individuals in the future related to immigration proceedings or criminal cases. We don't know if these individuals will be protected by GINA since many have been labeled as criminals, and there are many concerns as to the ethics of collecting DNA samples from children without parental consent. This may come up in a clinical setting if a patient provided such a sample at the border. Now we will move on to the genetic counseling strategies and resources, and we will begin with a case presentation.
So now I'll be sharing a case that illustrates some of the barriers and challenges to care that patients who are undocumented may face. But before I get into the case, I did want to provide some background information to provide some context in terms of where this patient was receiving their care. And so the patient case that I'll be reviewing today involves a patient who is undocumented, diagnosed with breast cancer, and receiving their care in California. In California, there is a breast and cervical cancer treatment program, which provides cancer treatment benefits to eligible low-income California residents diagnosed with breast and or cervical cancer. This program is open to individuals who are undocumented, albeit with more limited coverage in the past, because as of May of last year, there has been an expansion of this program where individuals who are undocumented may be eligible for full Medi-Cal or what's known as Medicaid in other states' healthcare services. And I wanted to highlight this because, as it said before, not only do policies that affect patients who are undocumented vary by state, it's also by legislation that's passed in a given year or what's available in a given time frame. Both this patient's family and personal history have been modified for patient confidentiality. This is a 50-year-old patient who was referred for cancer genetic counseling due to her young onset breast cancer diagnosis at 40 years old and family history of breast cancer. She was seen by our team and elected to proceed with genetic testing after reviewing the goals, benefits, and limitations of genetic testing, which identified a pathogenic variant in BRCA1. During our time together with the patient, she shared that she was undocumented, and this wasn't for eligibility for genetic testing services. At our institution, this is not really a factor that plays a role in eligibility for testing, but she shared with our team more so because she was actually going to be moving to the Midwest and was nervous about generally moving, transferring her care, being in a new place. When we followed up with this patient, she shared with us that she actually ended up moving back to California because she was having a hard time accessing healthcare in her new state due to her citizenship status. And so really one of the main takeaways from this case is that it's, again, challenging to provide general guidance for providing care for patients that are undocumented, because this will vary by state, by year. And so what's more important is that you all learn about your own city, your own community, and what services may be available to patients who are undocumented, but also the specifics of those programs. Like, for example, in our case, would eligibility be due to a cancer diagnosis? This patient qualified for services because she was diagnosed with breast, and we have that program in California. But had it been renal, had it been skin, would the patient have had a harder time accessing services? And also the time frame of when services may be available, as been discussed previously in the prenatal setting.
In addition to the logistical barriers that undocumented patients may face in a genetic counseling visit, as explained in the case example, we wanted to highlight the genetic counseling theories, frameworks, and strategies that may be most applicable when providing care for patients who are undocumented. Our vision for care delivery to this patient population is grounded in the reciprocal engagement model. As in all genetic counseling encounters, this model is well suited for engagement with undocumented patients because it promotes patient-centered care, effective communication, cultural sensitivity, shared decision-making, and psychosocial support. Within this framework, we believe that cultural humility is a particular important component. For those who might not be familiar with this term, cultural humility is a concept that emphasizes self-awareness and a willingness to learn from and about individuals from different cultural backgrounds. It involves recognizing and challenging one's own cultural biases, stereotypes we may hold, and assumptions, as well as being open to understand and accept the beliefs, values, and experiences of others. Overall, cultural humility promotes respectful interactions with an emphasis on building trust and collaborative relationships. Now, if trust is established, patients who are undocumented may feel more compelled to share their undocumented status during a genetic counseling visit. If so, we encourage that genetic counselors have an open dialogue about immigration-related stressors and ensure the confidentiality of the patient's disclosure. This means, for example, telling the patient that the information they share regarding their immigration status will not be included in the medical record. As communicated in an earlier section of this webinar, it's important to do so in order to provide a safe space. In addition to establishing trust via cultural humility, there are other techniques from each of the following therapeutic approaches that can help when encountering undocumented patients. For example, narrative therapy techniques can help patients externalize their feelings, which can then give genetic counselors a better understanding of the emotions they may feel and the reasons for what they may feel that way. Of course, in the context of their patient's immigration status. Also, strength-based approaches and solution-focused therapy approaches can help genetic counselors find ways to make patients recognize their inherent strengths, skills, and resilience, especially when considering their unique social circumstances and the limitations they may face. Related to this, it is important to recognize that patients' immigration status in conjunction with immigration policies may limit their self-determination and thus often contribute to a sense of lack of control. Positive reframing of experiences and the challenges they may be facing via cognitive behavioral therapy approaches can help address this issue by fostering a patient's sense of self-efficacy, which in turn will help them feel more in control of navigating their own healthcare journeys. This may, require implementing strategies that inherently encourages collaborative problem solving between patients and genetic counselors, which is essential for identifying relevant resources and devising strategies to address immediate issues. An example of this is helping patients find genetic testing options that may be available to them, such as free options. Lastly, in order to best help patients and find practical solutions, it might be necessary to seek help of other professionals within your own institution, such as medical navigators, translators, and financial assistant experts. Overall, genetic counselors play an impactful role in advocating for patients and connecting them to the resources that may be available within your own institutions and regions. Should your institution not have additional support for undocumented patients, we would like to share some resources that may be of help. The first is the National Immigration Law Center, and this is a helpful website which includes resources to understand the most up-to-date healthcare options available to undocumented patients. They also include more information, and if anyone's interested to learn more about public charge or resources about policies and protections that are applicable to undocumented immigrants. Of note too, they are constantly updating this information on their website regularly. Another resource to keep in mind is this a sanctuary doctoring video, which was created by a medical student from La Loya Medical Center. The video shows a role-play scenario that highlights how to communicate with a patient who may disclose their undocumented status during a patient encounter. Within our list of resources, we have included some articles from the AMA Journal of Ethics, one of which is focused on how to be a good sanctuary provider, and many other articles that are focused on issues that are important to the undocumented patient community. You can have access to these links on our website. The last resource included in our genetic counseling, that could be included in our genetic counseling toolkit, is the National Center for Legal and Medical Partnership. These are pro bono clinics that are typically ran by law students with the focus of advocating and representing patients who may need legal assistance to address health-harming social needs. We encourage you to look at your own institutions to see if this or similar types of resources are available. Now, when it comes to patient resources, we have provided a link on our website for the National Association of Free and Charitable Clinics. This website is helpful to find clinics that offer free of charge visits to patients. Of course, with a caveat, the genetic counseling is not usually a part of this free service. The National Immigration Law Center website is also a great resource for patients for the same reasons mentioned a few seconds ago. And then the Immigration Advocates Network has a directory where patients can search by state to find free legal services, as well as immigrant support centers in all 50 states. With that, we would also like to share some additional materials to support your own independent learning. Some of these resources go beyond healthcare and offer insights into the social and cultural aspects of life as an undocumented immigrant in the United States. Please feel free to take a picture of this slide, and please visit our website for the full list of books, videos, and learning activities to engage more with this material that we have shared today. And with that, we will conclude this webinar presentation. Here are our references. And thank you so much for listening.